In a 150-page document, the Government of India has detailed India's vaccination process and plan of action. So who will get the vaccine first? Data is being collected from government and private healthcare facilities and is being fed into the CoWIN application, which is India's digital vaccine management platform. The National Expert Group on Vaccine Administration in India has recommended that the vaccine will first be given to approximately 1 crore healthcare workers working in both government and private hospitals and COVID centers. These have been divided into subcategories: frontline and ICDS, workers, nurses, supervisors, medical officers, paramedical staff, support staff and even medical students. Second in line will be approximately 2 crore frontline workers. This will include state and central police departments, armed forces, disaster management volunteers, municipal workers, revenue officials, all those engaged in COVID-19 containment, surveillance and associated activities. These have been broadly categorized into Ministry of Defence, Home, Housing and Urban Affairs and will come under state governments as well. Third in line are persons above 50 years of age who have further been categorized into two categories, those between 50 and 60 years and those above 65 years. The latest electoral rolls for the Lok Sabha and the Legislative Assembly elections will be used to identify the population that is aged above 50. Now, this will be followed by people who are younger than 50 years of age and have associated comorbidities. Then, states and union territories will also have the flexibility to roll out the vaccine for the identified priority groups in geographical areas where the COVID-19 infection prevalence is high. Finally, once all of these categories have been covered, the vaccine will be given to the remaining population, and this will also be based on disease epidemiology at the time and of course vaccine availability. So how can you register for the vaccine? The self-registration module will be made available in the later phases of the implementation, but you can self-register on the government CoWIN website. You have to upload a government photo identity or do a Aadhaar authentication. Once you have registered, a date and time will be allocated for your vaccination and SMS will be sent to you with the details. Only pre-registered beneficiaries will be allowed to proceed for vaccination. You can't go to the vaccination center and register on the spot. District administration will be held responsible for the session management and the CoWIN system. Now, district administration will also approve beneficiaries for the session and site allocation. The CoWIN app, which is being built, will have this inbuilt monitoring and reporting mechanism in order to gauge who has been given the first dose, who is due for the second dose, and how many people have been vaccinated. Well, the next big question on everyone's mind: where will you get this vaccine? The vaccine sites have been allocated for different priority groups. Now, what are the different kinds of vaccine sites? Well, there is a fixed session site, which is at a typical health facility where a medical officer or a doctor is available. There are also outreach session sites, which is a vaccination site which is other than a healthcare facility, say a school or a community hall or a marriage hall where vaccine will be given. There's also special mobile teams that are a part of the operational plan. This is specially designed for remote areas, border areas, hard to reach far-flung areas of the country so that nobody is left out from being vaccinated. Well, what will this vaccination process entail? How is it that this entire process is going to work? Well, you enter the vaccination session area. There will be an authentication of all of your documents, your identity, that will be done. Once the authentication process is over, you will be given the vaccination by a medical expert, after which you will be put in a room for 30 minutes of observation. This is extremely crucial. Only after the 30-minute observation is complete and you have had no allergic reaction or adverse reaction to the vaccine will you be allowed to exit the premises. For this entire process to take place, there will be 3 demarcated rooms. An ideal site will have these 3 rooms: a waiting room where you wait before you can go in to get your vaccine shot, a vaccination room where you will receive your vaccine, and then an observation room where you will be observed for 30 minutes post receiving the vaccine. Remember, social distancing norms and masks will be compulsory and all COVID-19 protocol will have to be adhered to at the vaccination center. So who will give you the vaccine? This is important. There's a 5-member vaccination team that will be present at the vaccine site. Officer 1 will be responsible for pre-checking all your registration documents in order to make sure that your registration on the CoWIN application is correct. Officer 2 will do an authentication. Officer 3 will be the vaccine in charge. This will be the person who will administer the vaccine to you. And remember, only a healthcare professional can administer the vaccine to you because the coronavirus vaccine is a muscular vaccine and therefore only a trained professional can administer this vaccine. Vaccination Officer 4 and 5 will be in charge of crowd control and management to ensure that all COVID-19 protocols are adhered to, and will also ensure that you are kept under observation for 30 minutes after you've received your vaccine so as to monitor any adverse reactions.